Hello, everyone. Welcome. Thank you very much for coming. It's wonderful to see so many of you joining the second of our 3 sessions on nutrition and prostate cancer. So all of these sessions are part of our Living Well with Prostate Cancer webinar series. So as you'll have probably noticed, we don't have David with us today because he's on annual leave. So my name is Kath Coleman and I'm the Research Communications Assistant here at Prostate Cancer Research. So I'm standing in for David today and also next week for next week's session. So I'd just like to give a brief introduction to who we are at Prostate Cancer Research. So apologies to those of you who have joined the previous sessions because you've probably seen all of this before. But Prostate Cancer Research is a medical research focused charity, and we're focused on the prevention, diagnosis and treatment of advanced prostate cancer and better quality of life outcomes for patients. So we're really proud to fund 15 high quality innovative projects right across the UK, and they all have the shared aim of developing breakthrough treatments so that we can one day live in a world where people are free from the impact of prostate cancer. Some of our most cutting edge projects include one where our scientists are using machine learning and artificial intelligence to see if they can divide and conquer prostate cancer. So by looking at an enormous amount of data, they hope to be able to work out which prostate cancers need treatment immediately, which prostate cancers can be safely ignored, and also which treatments could be used for each individual person based on their own individual prostate cancer. We also have projects that are focused on existing treatments as well. So I'd like to take a moment to tell you about one of these, which is focused on making hormone therapy more effective. So hormone therapy works by stopping a protein called the androgen receptor from telling prostate cancer cells to grow. So the way it does this is the outside of the receptor acts like a switch. So when that switch is on, it then sends the messages to the cancer cells telling them to grow. And this switch is turned on by hormones like testosterone and turned off by hormone therapy. But unfortunately, for many patients, hormone therapy will eventually stop working. So the prostate cancers develop resistance and continue to grow and spread despite ongoing treatment. And one of the reasons for this is that the androgen receptor actually changes so that that switch part is missing. So this means that there's nowhere for the hormone therapy to stick to. And so the switch is kind of always turned on and sending those messages to the cancer to grow and spread. But thanks to our incredible supporters, we're actually funding Professor Ian McEwen and his team at the University of Aberdeen to delve a bit more into this subject. So they're actually researching new drug combinations which target the androgen receptor in a different way to current hormone therapy. So this means that these new drug combinations will continue to work even on those androgen receptors that are missing that switch part. And it could lead to new treatments for advanced prostate cancer that work beyond resistance to the current drugs. So these treatments would improve prostate cancer patients' outcomes and could also reduce side effects. So then beyond our research, we're also dedicated to educating, empowering and supporting our patient, partner, family and carer communities. So this is why we've launched this webinar series, Living Well with Prostate Cancer. So we've launched this series in collaboration with our good friends Tackle Prostate Cancer. So they're the UK's National Federation of Prostate Cancer Patient Support Groups. So this series, which runs until January, is going to cover a wide variety of topics. And these are all topics that you have told us that you want more information and more support on. So before we begin with today's session, just a few housekeeping points. So this is a Zoom webinar, so it's a little bit different to Zoom meetings, which we're probably all a little bit more familiar with. So when you join, all attendees automatically have their videos turned off and their microphones muted. And then the first 60 to 70 minutes of this session is going to be a presentation from our speakers. And then once that's done, we'll open up to questions. And we've set aside approximately 20 to 30 minutes for these, and we'll try to get through as many of your questions as we can. And you'll also have noticed that we don't have the chat function today, but we do have a Q&A box. So please do put any of your questions in there. And as I said, we'll get round to these once we open up to the Q&A. And then a final housekeeping note for today. This session is being recorded. So the recording will be sent around to everybody who's attending today, as well as being posted on our website and social media. And this means that anybody who couldn't attend today will be able to watch it on demand. So without further ado, I'd also like to thank our speakers, Dr. Daniela Moe and Mrs. Linda Mallinson from Functional Medicine Wimbledon. So they're leading the session today and actually all the sessions this month on nutrition and prostate cancer. So Daniela and Linda, over to you.
Hello, I hope you can hear us. Well, thank you for inviting us again to talk, and thank you to all of you out there joining us for the second talk in this three-part series, which is focusing on the nutritional and lifestyle strategies during treatment for prostate cancer. So we hope you found our last session, our first session, enjoyable and informative. And we'd like to thank everybody for the positive feedback we got from all the feedback that we got last week. Next slide, please. So just to remind us all, what we talked about last week was we focused on the nutritional and lifestyle interventions that are relevant to prostate cancer. Next slide, please. What we will cover today is we're basically going to introduce some basic concepts around detoxification and about how to detoxify prior, during, and after treatment. So the majority of the talk will center around how you can manage side effects from treatment with nutrition and with other interventions. Most of the recommendations we will refer to apply across the board to all types of prostate cancer treatment. However, towards the end, we will also focus briefly on the management of those side effects that are specific to radio and chemotherapy. Next slide, please. Right, so we are going to launch our first poll as we did last time. And the poll really is just to gauge what nutritional or other lifestyle practices you currently adopt whilst undergoing treatment. So these are the questions. Which of the following dietary interventions do you currently adopt to support detoxification? So you can tick as many as you like. Eat at least one serving of cruciferous vegetables a day. That's to say things like broccoli and cabbage and so forth. You drink green tea, you incorporate organic foods, you increase water intake or increase fiber intake. And which of the following non-dietary interventions do you currently adopt? Again, it's multiple choice. Increased exercise, acupuncture, reflexology, aromatherapy, EFT, which stands for Emotional Freedom Technique. It's a tapping technique. Engaging in hobbies and social interaction, spiritual practice, regular exercise. There is also a question about HBOT, which stands for Hyperbaric Oxygen Therapy. Breathing exercises, mindfulness meditation, I think I've mentioned all the others, so over to you. We'll give you just a few seconds to complete that and then we'll proceed to our talk.
Okay, yeah, I'll end the poll now and hopefully, can you see those results?
Not yet.
Oh, I have to click this button, that would help. There we go, can you see them now?
Yes. That's very interesting to see. Right. So we will be talking about regular sauna and hyperbaric oxygen therapy later and some of these other interventions, but that's also already very interesting. Thank you very much. Okay, next slide, please. So we're going to jump straight into principles of detoxification. Next slide, please. So one of the most common questions we get from patients who are about to undergo a cancer treatment is exactly when and how to detoxify. And the question is, why should we want to detoxify in the first place? So the reason is that, first and foremost, we want to remove the source of potential toxins which may be leading to or even exacerbating cancer. And these are environmental exposures such as smoking or alcohol, heavy metals, or chemicals like pesticides, which we may introduce with food. And this is because, obviously, once we start treatment, the body is going to be overburdened anyway with the treatment itself. So we don't want extras in the way for the body to have to deal with. So first and foremost, we want to remove the sources of toxicity. Then we want to remove the byproducts, the toxic byproducts of treatment, which may cause unpleasant side effects. And then finally, we want to help the body regenerate healthy tissue. Next slide, please. So which organs are primarily responsible for detoxification? The body is a very sophisticated machinery, and it engages many different systems to help it detoxify. There are very well-defined pathways that are responsible for changing toxicants into chemical products that are easier for the body to eliminate. So these are the main organs that are involved: gut, liver, kidneys, lungs, and skin. And the lymphatic system as well, and they work to reduce the body's toxic burden that is already present. Next slide, please. Right. This is what happens in the liver. There are actually 3 pathways of detoxification, but we're going to focus on these 2. What does it do? Basically, the liver is tasked with changing toxins that are initially fat soluble into compounds that are water soluble. And the reason for doing this is that the body can then remove the water soluble compounds easily. In the interim between fat soluble toxins and water soluble toxins, water soluble compounds, you get this intermediate state. And this intermediate state is one that's highly toxic and highly inflammatory for the system. There is an accumulation of free radicals that leads to this temporary increase in inflammation and toxicity. And it's this that kills the cancer cells, and this is a necessary part of the treatment. So whilst in general terms, outside of cancer treatment, in general terms, we would be interested in reducing the time that the body spends in this intermediate state, because it's a highly toxic state. During cancer treatment, we have to be very careful not to interfere with that, because that's the bit when the body is most responsive to the chemotherapy treatment. And this is relevant to what we're going to be talking about today. Next slide, please. This is a very busy slide, and I'm not going to talk about it in detail, but it's just to illustrate the fact that nutrition generally helps promote and helps facilitate this process from phase 1 to phase 2. So from going from fat soluble toxins to water soluble toxins. And there are many compounds in nature through diet that we can absorb into the system to help us with this. But again, the ones that are highly antioxidant, we want to avoid during active treatment. Next slide, please. So I want to be clear on the terminology, because sometimes these terms are bandied around and it's not always terribly clear. So what is an oxidative stress? So that's what happens in that intermediate state that we've just talked about. During that state, a normal cell will be attacked by these free radicals, and as a result, it breaks down. So you can see a normal cell on the left and what happens to it when it's exposed to free radicals on the right. Outside of treatment, what we would want to do normally is use antioxidants that basically intervene on that middle section. It mops up all those free radicals and stops the cell from being damaged. Obviously, we don't want that during active treatment, chemotherapy treatment. Next slide, please. So how do we actually avoid toxic exposures? This is a helpful slide which lists some of the things that we can easily do to reduce those exposures to toxins. By doing things, simple things, for example, like filtering water to remove heavy metals, or trying to use less plastic, for example, we are lessening the body's toxic burden. And in doing so, we therefore reduce the work that the body will need to do whilst under the effects of chemotherapy, which is in itself very highly toxic. We have to remember that detoxification draws on our energy in a very significant way. It's a very energy dense process. So we don't want extra things drawing on that energy pool. Next slide, please. This is another slide that you can take your time looking at later, but basically it's showing how various sources of toxins can enter our system through our lifestyle, the food and drink that we take, what's coming into our homes. And it also lists some of the key nutrients which we use in general terms in detoxification. Next slide, please.
Okay, going on to looking at detox foods and which foods we can include more inside our diets on a daily basis. If we can go to next slide, please. So these are many foods, or there are many foods that we can eat which support healthy detoxification. So here is a list just showing some of them, and it would be worth spending some time looking through this list and just seeing which foods you might find easy to include inside your eating. So some of the foods that stand out to me on this list are the allium vegetables, which are things like onion and garlic, as well as the cruciferous vegetables, which will get special mention on the next slide. Berries, we've got citrus fruits, we've got ginger, we've got green tea, we've got pomegranate on here. These are all good foods to be including regularly inside your eating. Next slide, please. Cruciferous vegetables get a special mention because they are so important. We should be trying to eat a serving of these vegetables every day, and particularly foods like broccoli, kale, Brussels sprouts. These all help lower the risk of disease, and they're especially useful in detoxification. Boiling and microwaving can reduce these active molecules in these foods. So to retain the full array of nutrients, it's best for cruciferous vegetables to be eaten either raw, perhaps like a coleslaw, a cabbage used in a coleslaw, or steamed, steamed broccoli or steamed cauliflower, or lightly sauteed, perhaps in a stir fry. And included in this cruciferous vegetable list are also things like rocket and kale, which I've mentioned, radishes, watercress, pak choi. So just thinking about ways to bring these into your diet more regularly, perhaps just a handful of rocket or watercress can be added to your plate as an easy addition, or having a few radishes as part of a snack or in your salads. And these can all help increase the intake of these important vegetables. Next slide, please. Here is another list of useful detox foods. A lot of it is duplicated. I just useful to see it in different ways. So yes, do take time to go through this list and add some more things to your current diets. Many of these can actually be added to smoothies. For example, we've got avocado, makes a smoothie nice and creamy. We can add beetroot or ginger. Berries can go into a smoothie. Flaxseed, ground flaxseed is useful. Green leafy veg, spinach, for instance, or kale can go into smoothies. Lemon can also, and turmeric. Green tea as a base for smoothies. Pomegranate. So many can be incorporated into drinks, or smoothies. And then using ginger and garlic in your cooking is a good idea. And coriander is an excellent detox food as well. So finding ways to have more coriander, perhaps in something like a carrot and coriander soup, or more curries, with coriander in those. These are all good things to have. Next slide, please. Here is an example of a wonderful detox drink. So much sort of goodness in one glass. So you can have a look at that and see all the different detox foods that are included in that drink. Next slide, please. And here's a detox smoothie, also just giving you some ideas as to what you can mix together. I think many patients who are not used to making smoothies often ask, or they're unsure about how to make a smoothie. So this diagram on the right-hand side of the slide is quite helpful in showing you the different elements that can go into a smoothie. We've got the base liquids, which could be things like cooled green tea or nettle tea or licorice tea. We've got the unsweetened fruit juices coming in next. That could be something like cranberry juice or pomegranate juice or dark cherry or purple grape or orange juice. Then we've got some fruit coming in, and I must say I find it quite helpful to use frozen berries for something like this. But anything that you have at home, some banana or some mango, anything that you have could go into this. And then you've got your whole vegetables as well. So this is where your avocado and your green leafy sort of veggie leaves can come in. Your mint is lovely to flavor a smoothie. Beetroot, courgette can all come into a smoothie. Then you have some protein. So protein is really important for detoxification. So adding some protein powder to your smoothie is a good idea. And these protein powders are readily available on the market. I normally would suggest a vanilla flavored one so that you can add various things to it to flavor it, or otherwise you get neutral ones as well. But these protein powders can be made from a soy protein base or from pea protein, hemp protein. You get rice-based protein powders. So there's lots of different ones on the market. Nut butters, such as almond or cashew nut butter, can be added to a smoothie as well. You could use a high-protein yogurt or some kefir. So loads of goodness. And then perhaps some flaxseed, ground flaxseed to get some fiber coming in. Fiber is really important for detoxification, so it's useful to add some flaxseed and then some ice or some water to that just to get the consistency right of the drink. And this will make a large drink, so it might be that you divide it up over 2 snacks in the day rather than try and take it all at once. Yeah, but it's just hopefully you find that helpful in terms of putting together a smoothie. Next slide, please. This would be an example of a day's food intake to support detoxification. You'll see many of the mentioned foods coming into this plan. So you'll notice things like spinach coming in with garlic and green tea. There's some flaxseed coming in the afternoon snack smoothie. You've got cinnamon coming in, berries, broccoli, cauliflower. So yeah, just a little example of a healthy day and how to include those foods. Next slide, please.
Okay, so here is a slide illustrating some potentially useful supplements for detoxification. This is the first of many slides we've put in this presentation listing useful supplements. In the interest of time, we will only be highlighting 1 or 2 from each group. So that if there are any specific questions on supplements, we can address this perhaps in the question and answer session. But I would like to, before we move forwards, I'd like to make a few important points on this. First and foremost, as always, as we said last time, obviously supplements are not intended to substitute your regular treatment. That goes without saying. The second thing to say is that our intention, as you'll see all these various slides with lots of supplements, is not really to encourage the excessive use of supplements. Okay, we're not asking you to go out and buy trolleyfuls of supplements. That's not the idea. The mantra is always food first. However, in certain specific circumstances, there may be 1 or 2 that are very, very useful for you, and they may also change depending on the stages of your treatment. So it might be helpful to consult a practitioner around this, but we will be highlighting a few as we go through. And the other important thing to say is that whilst we're cautious around the use of supplements during treatment, detoxification diet is fine throughout. That's the whole point. We want you to be able to have a diet that meets your detoxification requirements and that it's safe throughout your treatment. Next slide, please. Oh, sorry, can you go back to the previous slide? I forgot to mention Yes, out of this slide, I would highlight a couple in particular. Curcumin, so turmeric, which is part of the curcumin family, curcumin in general, you'll see it on many of these slides. It's a very effective and powerful anti-inflammatory. And it ticks many boxes. It has multiple actions, and it has a high degree of safety. So do consider this as one of your potential top 3 or top 5. And the other ones are the fiber supplements. Fiber, we want to prevent constipation. It's not everybody needs it. Some people don't need that, but that could be one to consider. And the protein shakes and smoothies to support detoxification, because as Linda said, protein is really important for detoxification. Okay, next slide, please. So as I mentioned before, supplements should be used with caution. In particular, antioxidants, excuse me, antioxidants should not be used during active treatment. This is because we don't want to interfere with that intermediate stage that I mentioned before, where the chemotherapy, excuse me, is very active, excuse me. Apologies. Next slide, please. So these are the common side effects of treatment. Next slide, please. So this is a comprehensive slide listing all the types of side effects from treatment, and it's across all the different types of treatment. Some of them are very common to all the different treatments. Others are more specific to certain specific types of treatment. We are going to list all of them as we go through and explain which dietary and supplement interventions may be of help. Next slide, please. So again, something about terminology. So inflammation is a common side effect of any sort of treatment. What is inflammation? This is a normal part of the body's defense to injury or infection. Basically, it's what promotes a repair in tissue. So we need inflammation, at least a small amount of inflammation, in order to bring about repair. But the problem arises when you have too much of it affecting too many tissues and it lasting too long. And that's when you get progressive destruction. Next slide, please. So inflammation can be generalized. It can affect the whole body, and we find this particularly after chemotherapy or hormonal deprivation therapy. And to help with this, there are lots of dietary interventions, an anti-inflammatory diet in particular, but also some supplementary interventions. Melatonin is one that's showing a lot of promise from the research. It's shown to have very significant anti-inflammatory properties, but it's also a hormone modulator, so it's a very important compound. Curcumin, which we've already mentioned, omega-3, which largely derives from fish oils, also has a very important general anti-inflammatory property, and CBD oil, which we will talk about a little bit more in detail towards the end of this presentation. And I know there was a question about that last time. CBD oil has some anti-inflammatory properties. In terms of localized inflammation after radiotherapy or surgery, for example, we can use local interventions like ice packs on the region. Hyperbaric oxygen therapy has been shown to be particularly useful in certain types of treatment like radiotherapy. Acupuncture can help as well. And then there are various topical ointments and creams that can be applied to the area to reduce inflammation. Next slide, please.
Okay, so we should all be trying to adopt an anti-inflammatory diet, as inflammation is the start of many diseases. So to do this, we want to make sure that we have high intakes of dietary antioxidants and phytonutrients with lots of different plant-based foods, lots of deeply pigmented fruits and vegetables, trying to cover all the different colors of the rainbow every day. We're also wanting to increase our omega-3 intake because this is very anti-inflammatory, and to do this we need to be eating oily fish on a regular basis, and perhaps if you're not eating oily fish you should be looking at taking an omega-3 supplement. There are some other foods which contain omega-3 like the flaxseed, chia seeds, walnuts are some of the foods that we could look at. We want to reduce the intake of this arachidonic acid, which is a very inflammatory sort of fatty acid, which obviously upregulates inflammation. And to reduce this, we want to restrict the amount of meat that we're eating. We want to restrict dairy and shellfish and animal fat. So one of the big areas of modulating inflammation is trying to ensure that we have a good ratio of omega-6 to omega-3. And for most of us, we have things totally out here with really high levels of omega-6, and we want to bring that down and we want to increase omega-3. So to reduce omega-6 intake, we need to be aware of things like sunflower oil in cooking or in any of our eating, processed foods, peanuts, vegetable oils are all very inflammatory, bringing in more omega-6 fats. And again, we want to increase that omega-3. Then we want to eliminate all hydrogenated and trans fatty acids, and these are foods that, such as baked foods, such as cakes and cookies and pies. These fats are found in shortening or margarines, found in microwave popcorn. And I just want to say here that, that microwave popcorn, there are chemicals on that bag, which when microwaved are very, very carcinogenic. So I'd be staying well away from microwaved popcorn. Frozen pizza, refrigerated doughs, such as biscuits and rolls, fried foods, including French fries or donuts or fried chicken, and coffee creamers. Often these dried milk powders, which are used in things like instant cappuccino sachets. We need to be careful of these. We also want to reduce alcohol, simple sugars, refined carbohydrates, and we want to focus on increasing our high fiber foods, which feed our good bacteria and keep the balance right in our gut. This is really important because a lot of the inflammation starts in the gut. Next slide, please. Here's some useful supplements that we use for helping with inflammation. We don't need to be taking all of these, but like I mentioned before, if you're not taking an oily fish on a regular basis, you may want to think about taking an omega-3 supplement. And things like slippery elm and aloe vera juice are very soothing on the gut, and they might help reduce inflammation at gut level. So these are some things, and of course the turmeric or the curcumin comes up again. Next slide, please.
So one of the most common side effects during treatment is cystitis or urinary tract infections, and also inflammation of the prostate itself. Next slide, please. So there are some things that we can do to help. Certainly drink plenty of water. You're trying to flush the inflammation out. Giving up smoking, very important. Smoking irritates and damages the lining of the bladder, so it's helpful to avoid that if possible. And some mechanical things, like avoid heavy lifting, trying to avoid constipation, trying to avoid sort of carrying extra weight if possible. So those things help. Definitely avoid alcohol, fizzy drinks, caffeine, acidic drinks like orange juice. And there's quite a bit of data showing the potentially harmful effects of artificial sweeteners in relation to cystitis or prostatitis. So definitely try and avoid that. Next slide, please. Again, some useful interventions here. The anti-inflammatories we mention are D-mannose, which is it's a sugar that has particular properties in that it seems to prevent bacterial adhesion to the bladder wall. In particular, E. coli, which is a common bacteria that affects bladders. Cranberry extract has a similar effect, so those can be quite useful adjuncts. Hyperbaric oxygen therapy has been shown to help in cases of post-radiation cystitis, and again, so has melatonin. Next slide, please.
Whilst going through chemotherapy, it's possible that you may develop a condition called neutropenia, which is where your neutrophils, a type of white blood cell, sort of become low. And these white blood cells normally fight bacteria, so having lower levels of them can put you at an increased risk of infection. If you do become neutropenic, then there will be some dietary precautions to be aware of, as some foods with higher bacterial levels will need to be avoided. This may include eggs that are not cooked through, or avoiding shellfish or sushi or raw meats, or any unwashed salad. But should this happen to you, then your dietitian at the hospital should be able to go through the things that you need to be careful of in the diet. I think what's interesting is it can take the immune system 9 months to recover after chemotherapy. Next slide, please. So nausea and vomiting is a common side effect as well of treatment. And if you do struggle with nausea and or vomiting, it is harder to stick to healthy eating. So, you know, it's important not to feel guilty about this. The other thing I want to mention is that during treatment, it is possible to acquire learned food aversions. So try not to eat your favorite foods before at the time of treatment, because they might make you feel nauseous, and you would not be able to eat them again in the future without the memory of feeling ill. So listen to the wisdom of your body and eat whatever nutritious food you feel that you can tolerate or enjoy. Small, frequent meals are helpful. Eating slowly. Foods are often better tolerated at sort of room temperature or cooled foods. Eating simple foods is just easier for the digestion. Drinking beverages cool and chilled may be helpful. Even freezing your favorite beverage in ice cube trays, or drinking or sipping liquids through the day might be helpful, or even using a straw might be better. Light foods, low-fat foods are often better tolerated. Drinking fewer liquids with your meal times, and allowing plenty of fresh air in the house, especially helpful to disperse cooking odors. And CBD has been shown to be helpful with this too. There are certain foods that may aggravate the nausea, so avoiding milk products or creamy foods, staying away from fatty fried foods. Sweet foods and desserts might worsen things, and also avoid lying down immediately after eating. Next slide, please. So loss of appetite is another common symptom that we see, and really your body's needing so much nutrition over this stage of treatment that it makes it really hard to eat enough when you don't have a good appetite. So important to try and eat little and often again. Smaller and more frequent meals is often better tolerated. Often the appetite is better in the morning, so try and use this time to get in a good sort of balanced meal. Dispersing cooking odors. Try not to drink with your meals because it fills up your tummy, so you can't actually get enough food in. Soft foods are often more appealing and easier to eat. Nutrient-dense drinks like smoothies might be helpful. It's often much easier to drink calories than it is to eat calories. So these nutrition drinks can be helpful. Trying to eat more high-calorie foods, such avocados or nut butters might be helpful. Doing some light exercise, getting some fresh air, or using CBD oil again may be helpful. And reducing the intake of empty calorie foods and drinks. So what I mean by this is foods or drinks that do not give you any nutrition. So for example, tea and coffee can take up place inside your tummy, or they suppress your appetite further. So rather try and have a smoothie or a fresh fruit and vegetable juice to get some goodness in. So that's all good information. Next slide, please. So tumor growth, radiation, and chemo treatments all have the potential to alter the ability to taste and smell. Foods may taste really bitter or metallic, especially meat or other high-protein foods, and many foods will have less taste as well. So the tips here should help make your food taste better. Including more cold foods and sort of milk alternative products. So we're always trying to reduce dairy with prostate cancer. So trying to have maybe some coconut yogurt or almond yogurt or oat yogurt are good sort of alternatives. Avoiding beef because it can taste really bitter. So rather substitute the beef with skinless chicken or turkey or eggs or maybe a mild tasting fish or some legumes. Improving meat flavors by marinating them in sweet fruit juices, sweet wine, Italian dressing, sweet and sour sauce or curry, just to help increase the flavor or the flavoring or the seasoning of these foods. And some people go off tea and coffee. You can try refreshing lemon or green tea, ice cold drinks instead. Using plastic utensils may be helpful. And reducing the intake of red meats, chocolate, tea and coffee, which often naturally happens because they just don't taste the same when you eat them. Next slide, please. Sore mouth and throat we occasionally see with chemotherapy. So you want to avoid anything that's going to aggravate the sort of a sore mouth. So on the right-hand side, you'll see things like salty or spicy foods, acidic foods, fizzy drinks, alcohol, citrus. Bananas can also cause stinging. Crisp or hard foods, granolas, extremely hot or cold foods you need to be careful of here. So try and have more soft, moist foods. Using a straw to drink might be helpful. And yes, keep your foods moist with lots of sauces and gravies just to help them slide down. Next slide, please. A dry mouth is something that we see as well. So I will say that there are lots of salivary substitutes available on the market. And, you know, if you're suffering with any of these side effects, whether it be the nausea and the vomiting or the sore mouth or the dry mouth or whatever it might be, it's really important that you bring this up with your doctors and your team, because there's so many products that can be used to help lessen the effect of these sort of lessen these side effects and to make it all a bit easier for you. And just with dry mouth, yes, there's lots of salivary substitutes available on the market, and they really are helpful. There's also products that help stimulate salivary secretion, and acupuncture has been shown to be very effective in relieving a dry mouth and in stimulating salivary excretion. So you would avoid things that would stick to a dry mouth, things like chocolate and pastry or thick cereals, dry foods, very hot foods, and alcohol. And again, eating foods with a high moisture content might be helpful. Having liquids with your meals to help wash things down. Chewing sugarless gum might be helpful, or sucking on mints or ice cubes may help. And very sweet or very tart foods and drinks might be helpful as well. Next slide, please. There are many sort of mouthwashes that you could try. Some of these are antibacterial, some of them are anti-inflammatory. So we've given you a list of various things that you might find helpful. Next slide, please. Diarrhea is, again, another common side effect. It can be from chemotherapy or from the radiotherapy. And the solutions or possible solutions here would be to try and eat smaller, more frequent meals, making sure that you don't become dehydrated, keeping to a low-fat, low-dairy diet. And you might need to reduce fiber intake if you're struggling with diarrhea. So limiting the concentrated sources of fructose or fruit sugar would also be helpful, because high concentrations actually draw water into the gut, which worsens the diarrhea. So avoiding sort of pure fruit juices, always diluting down, perhaps limiting honey or dates or figs. These are things that might be helpful. Eating bananas or potatoes, fish, chicken, drinking diluted apricot juice, tomato juice can help replenish some of the sodium and the potassium that's lost. And starchy liquids like split pea and potato soups or oats porridge or mashed bananas might be helpful, and eating foods at room temperature. If your diarrhea carries on for longer than perhaps a few days, it might be necessary to get some help from a dietitian who can guide you on a low FODMAP diet. This is very, very helpful at helping with gut symptoms and taking away the fermentable carbohydrates out of your diet. So yes, there is a lot of work that can be done with changing diet for helping with diarrhea. Next slide, please. Some supplements that could be considered, thinking about the slippery elm and the aloe vera, which are soothing to the gut. We've got pancreatic enzymes. You could take enzymes before each meal to help with the breakdown of the food, just helping your body absorb some of that nutrition better. And probiotics and prebiotics might be helpful as well. So those are some things that we could use. With constipation, we really want to avoid constipation, as we know that healthy elimination is important for detoxification. So there are many things that can be done to help with improving stool consistency, such as increasing fibers and drinking more water during the day. So we can use, fiber supplements if we need to. Things like ground flaxseed or linseed is just one of the things that we use commonly. Exercise can be beneficial, thinking about maybe using a rebounder, which is one of those small trampolines that you can jump on, and it just helps to stimulate the gut motion. Hot drinks can help stimulate the gastrointestinal tract movement as well. And using a footstool is also helpful to support the mechanics of emptying properly. So that's something that you could consider. And then again, reducing sort of gas forming foods might be helpful as well. Next slide, please. So there are, again, some supplements to help with constipation. There's lots of ways of supporting constipation. Some of these, like the fibers, the OptiFiber and the flaxseed, they add more fiber to the stool, so it helps with bulking and bringing water into the stool as well as important. So magnesium citrate or magnesium oxide is a larger molecule of magnesium, which draws water into the gut, so it helps with softening of those fibers. And then if need be, we can use things like prokinetics, which you can discuss with your doctor, and these help with gut motility and actually stimulating the peristaltic movement, so helping your gut contract to push things down. And you might know that sort of fibrogel, Movicol, these are things that are commonly used by doctors to help with constipation. So there are lots of things that we can do to help. Next slide, please.
So another common set of symptoms is to do with fatigue, low energy, and headaches. They're all really due to low energy states. And the causes are many, obviously, and we won't go through all of them, but it's just a reminder that detoxification requires a lot of energy. So it's drawing on your energy bank. And so the nutritional intake that you have at the moment may not meet your energy expenditure, and therefore that leads to low energy and to fatigue. There can be other reasons, of course. Anemia can be one of them, for example, in which case you may need a transfusion. But a lot of the time, fatigue comes from either loss of appetite or poor intake of nutrients or poor absorption of nutrients from the gut. And so we need to, depending on what we think the cause is, we may need to address it separately or differently. And so on the right-hand side, you'll see all the possible solutions that are found that in the literature show to be effective for this. Next slide, please. What about hormonal symptoms? We have, common to have hormonal symptoms when you're using hormonal deprivation therapy. Commonly we get hot flushes as one of the commonly reported symptoms, and this is to do with the drop in estrogen. So one possible way of helping that would be to include phytoestrogens, that's to say estrogens that come from plant origin, into the diet, and we can do that with increasing soya, for example. Erectile dysfunction is also a very common symptom, and there are lots of potential interventions here. First and foremost, there are those interventions that are related to circulation and to the supply of blood to the region. And to improve circulation, it's really important to avoid things like smoking and alcohol, which affect that side of things. To adopt an anti-inflammatory diet, because that has an effect on the health of the lining of the vessels, and therefore has a knock-on effect on things like blood pressure and constriction of vessels. So it's important to stick to an anti-inflammatory diet, optimize blood pressure with your practitioners, and exercise. Exercise needs a special mention here because it increases nitric oxide. Now, nitric oxide is believed to be one of the main mediators in erection. And so any way that we can find of increasing that nitric oxide may be beneficial in this scenario. And we know that exercise does that. Next slide, please. Alongside your medication review, which includes the considerations around medication that may bring about erectile dysfunction, and that's not just the hormone deprivation therapy, but also many medications can do it, you know, antidepressants or even some blood pressure medications can do it. So alongside that, you may be able to incorporate some of these other strategies. For example, the one at the end of this list, the L-citrulline, it promotes circulation and therefore helps with erectile dysfunction. It's also the natural equivalent of some of the medications that are used in erectile dysfunction. So there can be some use there. One thing to stress is that, as we did last time, and indeed again, I will say this again, that with these doses that we recommend, obviously you need to be careful. So too little may not be effective, but too much may also be detrimental. So you need to find the sweet spot. Also, when you are choosing any supplements, whether it's this or any other ones, you do need to make sure that your specialists are on board with it and that are happy that there are no interactions with the medications that you are taking. Even outside the chemotherapy itself, you may be on other medications. So do be sure to mention that to your doctor or to your pharmacist to make sure there are no interactions. Out of this list, I will also mention zinc because it has a very long list of beneficial effects, including hormonal regulatory effects. It increases insulin sensitivity, which is something that we often find impaired during hormone deprivation therapy. So using zinc might help a bit. We also know that prostate cancer tissue is usually depleted, brings about depletion of zinc. So we want to bring some into the equation. Okay, next slide, please.
Right, we also occasionally see patients gaining weight during treatment or having problems with their blood sugar and perhaps even with their cholesterol levels increasing as well. And there are many dietary things that can be done here to help with all of these. So ensuring that you're following a low glycemic diet. We covered quite a lot of this in the first session and we'll look at it again next week. But the principles here are small portions of slow release carbs at each meal, concentrating and focusing on whole grains, protein and fats with the meals to slow down the release of glucose into the bloodstream. And cold cooked carbs are often better because they are higher in resistant starch, which takes longer for your stomach to break down. So you get a better, slower release of glucose into the bloodstream. So for instance, having potato salad or brown rice salad or quinoa salad are all beneficial. And trying not to overcook your rice or your pasta because overcooking it sort of allows the breakdown to happen quicker in your stomach, and hence it tends to cause your blood sugars to rise even more. So intermittent fasting, time-restricted eating is also helpful, as is exercise, and then we can get on to a cholesterol-lowering diet as another thing that is very helpful in reducing cholesterol levels. Next slide, please. Some supplements to help with these areas. We've mentioned a few here, that the top ones which help with insulin sensitivity and blood sugar regulation. And then towards the bottom of the table, we've got resveratrol and red yeast rice, niacin, which all help with lowering of cholesterol. So yes, there's lots of additional things that we could use to help with these side effects as well. Next slide, please.
So some people may experience pain and in the course of their treatment, and these are some non-drug interventions which you may find helpful. Next slide, please. Peripheral neuropathy means a pain relating to nerves. And here are some supplements that sometimes are used and are found to be beneficial. We know B vitamins are commonly used for this. But there's another one in this list. You'll see PEA. This has been, it's a fatty acid that is produced naturally, and it can be found in some foods like soy lecithin or eggs or peanuts. And it's been shown in some cases to be helpful for nerve pain. Next slide, please. So let's talk about CBD oil. There have been lots of questions about this, and so it has been shown to have lots of potential properties: anti-inflammatory, antioxidant, anti-tumorants, and so forth. It is legal to use, hence the proliferation of its use all around us, so long as it doesn't have more than 0.3% of the psychoactive component to it. It's called THC. So most of the, well, all of the legal CBD on the market should have less than this in it. So it doesn't have any psychoactive properties, but it seems to exert its action by interacting with these receptors, CB1 and CB2, which is found to be active also in prostate cancer cells. Next slide, please. So it can be used in all of these conditions: pain management, it supports gut health, it supports immunity. It helps, as we've seen before, with appetite stimulation and inhibits nausea and vomiting. It can help with insomnia. People who want to use it just purely for sleep, to help their sleep, may perhaps take it at night, but it can be taken during the day as well to help with all of these other conditions. A useful guide to the dose is mentioned here: 1 to 6 milligrams for 10 pounds of body weight. There are lots of different preparations: as liquid, sprays, gummies, all sorts of different things. It has quite a high degree of safety. So I think, but as always with anything that you might use, you want to start low and go slow, and always mention this to your practitioners when you embark on any extra, taking any extra supplements. Next slide, please. We also know from studies that reducing stress and managing mood has an effect on pain management as well. So these are all the things. Some of them are perhaps intuitive. You know, you want to make sure that you have good levels of social interaction, that you're not neglecting your hobbies and things like that that really nurture you. But also things like aromatherapy, acupuncture, emotional freedom technique, which we mentioned before, tapping, has found there's some mention in the literature about that, and taking care of your gut health. Sleep routines, really important for general health and for pain management. And there's some mention of music therapy also in the literature. Next slide, please.
Yeah, we've still got plenty of time, but just letting you know that it's 3:30.
Thank you. So here are some of those supplements again that might be helpful. I'll just mention L-theanine out of these. quite helpful in reducing anxiety. It taps into some of the neurotransmitter pathways, in other words, those elements in the body that help regulate our mood. Okay, next slide, please. Right, saunas, near-infrared light therapy, and hypothermia. So why do we suggest these? Because any intervention which increases the delivery of oxygen to cancer cells will potentially reduce the ability of the cancer cells to survive. Why? Because cancer cells love low oxygen states. They thrive when there's not a lot of oxygen around. So when we deliver more oxygen to the area, they will suffer. So various treatments can be helpful in this respect, and this is one of them. So if you increase body temperature through saunas, through light therapy, you can bring more blood to the area, if you like, and that will deliver more oxygen. It also seems to sensitize cancer cells, so it seems to be helpful. And again, you know, the side effects from that would be non-existent. So it's a safe treatment. Next slide, please.
Okay, so looking at some specific things related to radiotherapy. Next slide, please. So we know that radiotherapy is very local and direct on a certain area. So the side effects of radiotherapy tend to stay or to be localized. Hence, things like bowel problems are sometimes seen in patients who've been through radiotherapy treatment for prostate cancer. Next slide, please. There is evidence that antioxidants may interfere with the action of radiotherapy. And we know that radiotherapy keeps working actively for about 2 to 3 weeks after it finishes. So high doses of antioxidants are avoided until after this period. But once this period of 2 to 3 weeks has elapsed, then it is time, it is the right time. And this is when you can start replenishing the depleted antioxidants through diet, and perhaps through the use of supplements as well. Next slide, please. There's a list of supplements which, I think it is mostly supplements, and we've got some HBOT as well, some oxygen therapy with oxygen, or exercising with oxygen, which all of these have been shown to enhance radiation and at the same time to actually protect the normal cells. So these should be safe to do alongside your radiotherapy treatment. But once again, just ensure with your oncologist or your radiotherapist that they're happy for you to be on these. But they have been shown to be safe. And after radiotherapy treatment, there's a list of supplements that you may find helpful here. Again, speak to your practitioner about these. Some of them help with supporting the immune system. We've got some that are helpful for detoxification, and some nice things like Epsom salts baths, which is supporting detoxification through the skin. We've got some adrenal support, and some pain management there again with the hyperbaric oxygen therapy. So all useful things to consider once your radiotherapy has been finished. Next slide, please. Sorry, next slide again. So I think I've just touched on that one. Yeah. So most of the damage is done by the heat generated in the body tissue by radiation. And when radiotherapy is given daily, then the heat builds up over time. So it's helpful to use cold packs on the affected area for 5 minutes on the hour. Every hour has been shown to be really helpful. And this does help prevent fibrosis underneath the skin. And there's also some helpful creams that I've listed here, which help reduce inflammation on the skin. Next slide, please.
So just a little bit on hyperbaric oxygen therapy. So we've mentioned it many times today. And the reason is because, as I said before, what we want to try and do is oxygenate. So we want to make sure that there's plenty of oxygen getting to you. And also around the prostate cancer, we know that the tissue doesn't like oxygen. So if we deliver more oxygen to it, we have better chances of managing it. And also it helps with healing tissue around it after treatment. So that is why it's gaining traction, and it can be used directly after radiotherapy, for example. There are many centres that do this it's possible through the Hyperbaric. I'll give you the details later. I've got a link to the association, the British Association of Hyperbaric Treatment, which might be helpful to find out where you can access this. But just to mention that it is all about delivering greater amounts of oxygen. Next slide, please. I think we've already touched on that. Next slide, please. Next slide, please. We're going to talk about chemotherapy briefly to say this, that it's important to prepare for chemotherapy just as much as it is to be supported throughout chemotherapy. The areas that we would look at from a nutritional perspective and from a lifestyle perspective are around supporting things like gut health, your immunity, making sure you have an anti-inflammatory diet and lifestyle, that there's good blood sugar regulation, because all of these things put your body in the best possible place to face chemotherapy. Next slide, please. The most common side effects of chemotherapy are related to the changes in your nutritional status. So what can happen is that you can lose appetite, there can be taste changes, there can be nausea and vomiting and bowel issues. So effectively what results from that is a reduction in your nutritional intake, and that can also lead to weight loss. And weight loss itself affects the binding of the chemotherapy agents and can cause increased side effects of treatment. Next slide, please. Some people advocate fasting before chemotherapy. So this is relatively new, but we will talk about it for a minute. It seems that fasting renders cancer cells more sensitive to chemotherapy. And maybe it also reduces side effects in some people. So what does that mean? You would have to build up from fasting for 12 hours prior to your chemotherapy session up to 18 hours, and it should be done slowly. But there is caution around that, of course. We don't want people to lose too much weight. Fasting doesn't affect normal cells, so that's an important point to remember. Next slide, please. Important to remember that, again, what we said at the very beginning is that antioxidants should not be used. Antioxidant supplements should not be used during chemotherapy, because you'd be neutralizing its effect, or at least hindering it in some way. The thing to remember is also that different chemotherapy drugs have a different half-life. Half-life is the time that it takes for the drug to be removed from the system, and it can be 12 hours for docetaxel, but up to 95 hours for cabazitaxel. So we want to be sure that you leave enough time after the treatment before you attempt using any antioxidant supplements. However, you can be on a detox diet safely. Next slide, please. So this is one always to sort of mention to your doctor. If you're planning on trying any supplements, you must consult because of the interactions. Some supplements from the literature, and when I say literature, I mean from the scientific literature. And I think there was a question about that in the Q&A box. I mean from the data that we read, we see that some supplements, like the ones derived from green tea or from grapes, for example, resveratrol and curcumin, they can enhance chemotherapy. But as always, do talk to your practitioner. Next slide, please. We're coming to the end of our presentation, so I'm sure there will be lots of questions. This is just a list, a table of supplements that you should avoid during chemotherapy. They're not specific to prostate cancer. Some of them relate to other types of cancer, but we put it here, but just to remind you that there can be interactions. And so if you are going down that route, you should always make sure that that has been checked. Next slide, please. Yes, these are other interventions that are possible after chemotherapy. I won't go through all of them again because we are running out of time. Next slide, please. And these are supplements that may support your liver after chemotherapy. Milk thistle is one that's commonly known, and another one called N-acetylcysteine also is very good at supporting liver detox. So we've come to our final poll, and I know there's been a lot of information today, quite difficult to perhaps to take in all in one go, but hopefully with the slides you'll be able to have a look at them again and see if there are areas that you might want to delve into a little bit more. As always, we're happy to take questions. So this is our poll. Having gone through that, can you perhaps tell us now, which of the following interventions do you plan to adopt if you haven't already? And we'll give you a few minutes to complete this.
I'll give another 30 seconds because we've still got lots of answers coming in. So, and I'm going to end the poll now.
Okay.
Share the results. Can you see those?
Thank you. I'm just going to scroll down to have a look. Right. Very interesting. Okay. So there are a few more people coming in with potentially using some of the extra therapies, such as the sauna, the hyperbaric oxygen therapy, breathing exercises, mindfulness meditation. Brilliant. Wonderful. Thank you. So we have come to the end, and we will take questions now.
Brilliant. Thank you both so much. That was really, really interesting. So yes, we've had lots of questions come through already, but I thought I'd start with a question that we actually had submitted in beforehand. So they just wanted to know a little bit more information about diet soft drinks and what it is that makes these kind of problematic, or why you should avoid those.
So the sweeteners inside diet soft drinks actually are very damaging to the gut microbiome and actually kill off a lot of the bifidobacterium and the important bacteria inside the gut. So it has a lot to do with the gut microbiome, but also they're chemicals. You know, they're adding more to your toxic burden. So they also, you know, diet drinks have got nothing in them that's good for you. There's not anything nutritious inside them. So it's again, if you've got a decreased appetite, or you're not taking in as much goodness as you should be, they're really taking up space of something that you could be having that's more nutritious. Yeah.
Brilliant, thank you. So we've also had a few questions about the detox smoothie and creating one of those. So is there an ideal kind of ratio of fruit to vegetables? Is there a specific order you need to put things in? And also a question about smoothies versus juicing.
Okay, so there should always be more vegetables to fruit inside a smoothie. You don't want the load of the sugars being too high. So yeah, just try and keep that equal fruit veg, or if not, slightly more vegetables to fruit. The smoothie versus juicing is a good question, because smoothies generally have the whole part of the vegetables and the fruit in them, so it contains all the fibers as well. Whereas when you're juicing, you're getting all the antioxidants and the phytonutrients, but you're not getting the fibers. So it is still a good option. And as long as you've got then the fibers coming in your diet in another way, or you can also just take some of the extract that's sort of comes out of the juicing process, those fibers that are left behind. You can almost take 1 or 2 teaspoons of that and mix it back into the juice, just to try and include some of those fibers into the juice. So I think a combination of the two, but just always making sure that you've got enough fiber coming into the diet. Unless, of course, you might, if you're struggling with diarrhea and you need to reduce fibers, then perhaps juicing might be more beneficial. But again, you don't want the sugar load being too high. So it's just trying to get that balance right. Yeah.
Sorry, and do the ingredients, is there any specific order to ingredients?
No specific order. Anything goes.
Okay, great. So somebody's also asked, is there a downside for prostate cancer patients due to the announcement made today that a folic acid additive will be added to non-wholemeal flour?
Shall I take that, Daniela? No, I don't think there's any downside. I don't think there'll be any risk. But what I did pick up on that announcement, that it's not in any of the wholemeal or any of the whole grain flours. It's going to be in the refined flours. So that's not, exactly the foods that we're wanting you to be concentrating on eating, really. So yeah, I guess I was a bit alarmed when I saw that this morning, that it was going into the refined products rather than into the whole grains, which is where we actually need it or want it. Yeah.
Mm-hmm. And then a couple of people have kind of asked about different spreads to use. So if margarine contains hydrogenated fats and butter has dairy, are there any kind of spreads that you would recommend that people use? And also things like olive oil, should people avoid that, or is that something that they can use?
No, definitely not. Don't avoid olive oil. Olive oil is a great food, especially those unrefined extra virgin olive oils that have got lots of, you can see the greener it is, the purer it is. It's full of these amazing anti-inflammatory molecules. So I'm very keen on olive oil. To be fair with spreads, we shouldn't be eating that much bread. We shouldn't be needing to use spreads that much. I would totally stay away from any margarines, but you do get olive oil spreads, so that could be an option. Otherwise, using small amounts of organic butter would probably be okay. But again, it should be, we shouldn't be having huge amounts of that coming in anyway because of the reduced carb, or, not eating too much bread is important. Yeah.
Okay, great. Thank you. So a couple of people as well have just asked about turmeric and curcumin, about whether they should be worried about the fact that they've heard that it has quite a strong anti-platelet effect.
I think in general terms, this is a common question that comes up even with the fish oils. They do have anti-inflammatory effects and they can have anti-platelet effects. I think it depends on the circumstance and on the individual and what they are taking, as well as potentially taking curcumin or turmeric. In general, they are deemed to be very safe. But of course, there may be individual circumstances where that needs to be evaluated. So I would certainly, like with all these supplements, I would be just running it by the oncologist or your doctor, just to make sure that maybe you're not taking another medication that would interact. But in general terms, especially at the doses that we're suggesting, they're really quite safe.
And so looking at turmeric or curcumin, is it kind of one or the other? Is one better than the other?
Curcumin is the family, so okay. That's what you would be looking for.
Okay, great. Okay, let me have a look. So then somebody's also mentioned about grapefruits and the concern that it could interact with some medications as well, so blood pressure and chemotherapy.
Yes, absolutely. Usually there's a whole bunch of medications that should not be taken alongside grapefruit juice. Usually the pharmacist will advise you about that when they're sort of dispensing them. Yes, and in that case, that's the case, right, Linda? I don't know if you've got any.
No, that's absolutely right. Always to be careful with grapefruit, yeah.
Mm-hmm. So I guess that leads on to another these two previous questions lead on to this one, which is, I think you've probably already mentioned it, but should you always consult a pharmacist with existing medication?
100%. And anything that we have discussed today always needs to be sort of evaluated. Somebody, I think there was a question which I saw briefly flash in front of me, was about melatonin, for example. Melatonin cannot be bought, it should be prescribed, at least in this country. I mean, abroad they have different regulations around melatonin. Here it needs to be prescribed. Please make sure it's a practitioner who does guides you and prescribes where it's appropriate.
Mm-hmm. So then a couple of questions about green tea as well. So can I swap red bush tea for green tea? And also somebody who doesn't have any hot drinks, so is green tea just as effective when it's cold?
Yes, absolutely. So swapping the red or the rooibos tea for green tea is a good idea, remembering that green tea naturally is very high in caffeine. So if you are someone that doesn't metabolize caffeine very well, then you might want to use decaf green tea, which still has the benefits. The trick with green tea is actually to make sure that it's brewed for over 5 minutes to get those active molecules into the water. So it's great to have it cold. Many people would brew a teapot in the morning and just leave it on the side and just go to it during the day and top up their glass. So there's no problem at all with that. I think that's all that I need to say.
Okay, great. And this question is going to test my pronunciation, but is psyllium husk powder a good source of fiber?
Yes, it's a very good source of fiber. It's also non-fermentable, so it tends to be well tolerated by people that have sort of problems with bloating or gas production. So psyllium husk is it's good. It just doesn't contain the omega-3. So whereas flaxseed contains, ground flaxseed has the benefit of some omega-3, the psyllium husk doesn't have that, but it is a good source of fiber. Yeah.
Mm-hmm. And there's also a question on the potato salad and having potatoes cold, and how that kind of fits in with kind of avoiding white potatoes and having sweet potatoes and stuff instead.
Good question. So I think previously I was mentioning that sweet potatoes had a lower glycemic index. They were a better choice to normal potatoes. But the one way that normal potatoes are better in the glycemic story is that when they are cooked and cooled down, the starch gelatinizes again, and you get this resistant starch which forms, and that actually then makes that potato starch become slow release. So it would be fine to have potatoes in a cold form to help with glycemic regulation. Obviously in small portions still, you don't want to be eating too much of it, but it's definitely the safer way to eat potatoes. Yeah.
Mm-hmm. And then so CBD oil, is there kind of the best time in the day that you need to take this, and also is it kind of readily available to purchase?
It's very readily available to purchase. I would say that I would just check, just do a little bit of research. There's a lot out there, and like with all sort of relatively novel treatments, there'll be all sorts of things on the market. So just do a little bit background home and make sure that you're happy, that they go through, and it should be stated on their website that they go through certain types of checks, that they are standardized so that each batch is they can go back to the original product and so forth. So those basic things, that's number one. Number two, you can take it any time of day. Clearly, what I normally suggest is that if you're using it to help with insomnia, for example, you might start in the evening, that's the time to do it. But in fact, because it's used for lots of different functions, you can very easily do it during the day. Maybe you start twice a day. Maybe you start with, if you're using drops, you might start with 1 drop in the morning and 1 drop in the evening. Under the tongue for 30 seconds and see how that works. And if that doesn't really do very much, maybe over a couple of days you can increase it to 2 drops and so forth. You get to a point where you notice a difference. It may or may not do anything for you, but the research out there is quite promising. I should stress that the research around CBD oil, although there's quite a lot of it at the moment, Most of it relates to research in laboratory conditions and in animals. There are no, as far as I know, large-scale studies in humans, but it is thought to be safe. So I think to some degree, always with everything, use it in moderation and you should be okay.
Great. And also, so soya, you mentioned earlier that soya was quite helpful. Are there any kind of good forms of soya to add to your diet, or ways that you can increase soya intake, whether that's recipes, etc.?
So the guidance is to have 2 servings of soy a day, which is pretty easy to do, thinking that we're aiming to try and reduce dairy. Bringing in some soy milk is great. So the brands which are fortified with calcium is what you would be looking to have. So the Alpro brands, for instance, have got the calcium fortified to the same level as dairy. So that's an easy substitute. Then you've got things like, you've got sort of breads that's like Vogel soya and linseed bread, which is a slow release bread as well, so it's got that benefit. You've got edamame beans, which can come in. You've got soy yogurts. You've got tofu, and quite a few sort of vegetarian alternatives that contain soy as well. So with 2 servings a day, it's quite easy to bring in. Just two of those. I think in my talk last week, I had a slide that showed what a soy serving was. So perhaps it might be useful to go back to that and have a look.
Okay, great. Right, I think we might be able to squeeze 2 more questions in. I'll see how we go. So a lot of people have asked if you could kind of expand a bit on optimized blood pressure.
Optimized blood pressure. Yes. So it's quite a broad subject, but let me see if I can make it simple. The way in which blood pressure happens is because quite often, I mean, one of the main reasons is because there is some hardening of the arteries. And so the basic biological reason behind that is that there's some inflammation that happens in the lining of the arteries. And so what we do is to try and reduce those inflammatory changes on the lining of the arteries, and that to some degree will help reduce the hardening of the artery itself. If that's the case, then it's less likely that you'll have high blood pressure. I've made it extremely simple in that answer. It's much more complex than that, obviously. There are genetic reasons. There are reasons that are related to the functionality of the heart and the kidneys and so forth. So there's much more to it. But in terms of the dietary interventions that we would want to focus on, these are anti-inflammatory because the basic problem that we're facing is that the lining of the artery is inflamed, and then that in turn triggers certain types of changes that may lead to high blood pressure. That's why we do the anti-inflammatory diet.
Okay, brilliant. So do you recommend the daily use of pre and probiotic non-dairy supplements, e.g. Actimel?
Okay, so with the Actimel and the Yakults, they I suppose are helpful. They don't have very high levels of probiotics inside them. As part of the diet, I guess yes, they would be fine. But when we are looking at repopulating the gut microbiome, then we want to go into much higher doses than what's available inside those products. So we're looking more at supplements for that. Actimel does not contain any prebiotic. I think it's just a probiotic. So it's got the live organisms inside it. It hasn't really got the prebiotic fibers which feed the organisms. So yes, it's really, I think they're fine as part of the diet. There's no harm in taking them, but you certainly would probably need to be taking much higher doses for repopulating the gut.
Okay, great. Okay, right. I'll try and squeeze a few together, see if we can get a few more done before we finish. So there's just a couple more questions on specific things that people use in cooking. So whether it's okay to use rapeseed oil in cooking, asking about a broccoli sprout juice, whether that would be helpful as well, and also consuming kefir daily. Is this good or bad?
So rapeseed oil is fine. It's a good oil to use at high temperatures because it doesn't convert to a bad fat when cooking. It's also got some omega-3s in it. So rapeseed oil, which is canola oil, is fine in cooking. Kefir on a daily basis, yes, that's good. You can get a milk-based kefir, coconut-based kefir, or water-based kefir. All of them are helpful. So they've all got the probiotics in them, which is helpful. And your third question was?
So sprouting broccoli and using that in
yes, absolutely.
juices.
My goodness, broccoli sprouts are powerhouses. They're amazing. So if you can use broccoli sprout or make broccoli sprouts, especially using organic broccoli seed, it's got the most amazing amount of sulforaphane in it, which is a phytonutrient and very, very good for cancer. So I love the idea of sprouting broccoli. And yes, if you can put that into salads or you can add it to a smoothie, it's amazing. So very, very, highly recommended.
Brilliant. Thank you so much. I'm glad we managed to squeeze in a few extra ones at the end. So I think that's unfortunately all we've got time for today. I'm sorry we couldn't get round to all of your questions. We had lots submitted, but we are back next week for the third session on nutrition and prostate cancer. So hopefully we'll be able to answer a lot more then. So a huge thank you, Daniela and Linda, and thank you to everybody who submitted questions today. So I hope to see you all again next week, and thank you very much.